Heart attack equals muscle death. It's fast, it's permanent, but it's preventable. Here's how to recognize it and what to do in seconds. Let's talk MIs.
Hey guys, my name is Brad and welcome to nursing.com, and in today's video what we're going to be discussing are MIs, also known as myocardial infarctions. We're going to discuss some of the patho behind myocardial infarctions as well as the patient presentation and how we might treat the patient. So without further ado, let's dive in. So whenever we're talking about MIs or myocardial infarction, I like to break it down like this. It helps it make sense. Myo meaning muscle, cardial referring to the heart itself. So we're talking about the heart muscle, and we're talking about an infarction, which is permanent cell death. Now, MIs are the result of a lot of various different factors, right? We're talking about prolonged hypertension, prolonged constriction of these vessels that feed blood into the heart, as well as the deposition of atherosclerotic plaque in the heart, right? Which eventually leads to a blocked artery. We spoke about this a lot in angina, the way in which the narrowing of these vessels results in less fluid, less blood being delivered to the tissues of the heart. But the way in which I like to think about this, right? I like to think about this nice pool, this nice pond at the end of this river, right? This is the way I think about it. And let's imagine we've got these little fat beavers, right? I like to think about them like little fatty beavers coming in and building a dam. They're slowly building a dam and they're slowly depositing fat across this river. Now, what's going to happen? Imagine that this pond here is the heart, okay? This is where all this flow is going. And this is one of our coronary vessels. These little fat beavers are depositing this atherosclerotic plaque across this river. And what's going to happen over time? Eventually, if this river completely gets blocked off and that dam gets built, we're going to lose flow through that coronary artery to that heart. And this is what ends up resulting in a myocardial infarction, a complete loss of blood flow to an area of that myocardium, kind of like we see here.
Look, PowerPoints won't save you, professors won't save you, and that sinking feeling you're feeling in your gut right now, that's real. Nursing.com is the reason over 300,000 nursing students have gone on to pass the NCLEX and become practicing nurses. Get your nursing survival plan over at nursing.com right now.
So how is our patient going to present? Well, the first thing that we're going to see is chest pain. That's the primary reflective indicator that this patient is experiencing or may be experiencing a myocardial infarction. You can imagine as that heart is hypoperfused and not getting the blood it needs, it's going to cause chest pain. Chest pain, again, can be described in a lot of different ways, such as stabbing or burning. It can also radiate throughout different parts of the body, down the arms, to the jaw, through the back, into the shoulder blades. Shortness of breath is also something that's not uncommon with patients who experience MIs. Think about it. A portion of that heart muscle, like we saw in that previous slide, is damaged. It's not getting the oxygen it needs. So the heart starts pumping harder in an attempt to compensate for that loss. And as a result, we have an increased myocardial oxygen demand. So a patient is going to end up being short of breath as a result. So some of the other things that a patient may present with are abnormal EKGs. We specifically look at the ST wave, right? What you're used to seeing in patients who have MIs are ST elevation or ST depression. Make sure you freshen up on our EKG course if you're unsure what I'm talking about. But this change in our ST wave is directly reflective of either cardiac ischemia, lack of blood flow, or actual infarction. We could also see an irregular heart rate or rhythm. Remember that cardiac, that electrical conduction system, the SA node feeding into the AV node, so on and so forth, actually is housed within that heart muscle itself. So as that blood flow to the heart muscle gets impaired, so does the perfusion to that electrical system. Tachycardia, as we just described previously, increased myocardial oxygen demand. The brain is thinking the heart is not getting blood flow like it needs to. Let's work harder. So tachycardia ensues. Hypertension versus hypotension. Typically, you'll see hypertension initially in patients experiencing MIs. Patient is in bad pain. Sympathetic nervous system is kicked in. Fight or flight response. Blood pressure goes up. But should an MI progress far enough, should the damage to that heart muscle become extensive enough, that heart muscle is then going to be greatly weakened, stunned, and its ability to pump effectively is going to be greatly reduced. As we just described, increased myocardial oxygen demand. Patients are going to be short of breath. They're going to have low O2 sats and are usually going to require some supplemental oxygen. And also one of basically the gold standard for laboratory values are troponins. We will typically trend troponins, which is a cardiac enzyme that gets released into the bloodstream anytime that the heart sustains an insult or an injury. So trending these troponins are going to be important so that we can know the extent to which a patient's heart may or may not be damaged. So what are we going to use? What kind of medications or treatment modalities are we going to use for patients with MIs? You're going to see, pharmacologically speaking, antiplatelets being given, such as aspirin, to prevent further platelet aggregation to that clot within that coronary vessel. Also anticoagulants, such as IV heparin. Again, these are medications we see all the time in the CVICU. We would give IV heparin to try and lubricate and maintain patency of that coronary vessel. You would also see vasodilatory agents being given, such as nitroglycerin or morphine. Again, the overall idea, we have a blocked coronary artery. It's blocked. It's very narrow and it's hard for blood to pass through. If we can dilate that vessel, then we can allow more flow through that vessel to the heart. We're also going to treat chest pain, right? We mentioned morphine. It's not only a coronary vasodilator, but of course we know it helps treat pain. Now, the last two bullet points here are PCI, percutaneous coronary intervention, as well as a CABG, coronary artery bypass graft. These are actual surgical interventions, invasive interventions, I should say, used to treat MIs. We see PCI all of the time where I work at. Basically, they go in threading a small catheter up through the groin or through the arm up into the coronary vessel itself. They're able to inflate a balloon within that vessel, which basically squishes all of that fatty beaver deposit up against the vessel wall. It squishes it up against the vessel wall, and then they deploy a stent, as we can see in this image, to keep that vessel open and maintain patency of that vessel. If PCI is unsuccessful, then you could move to a more invasive surgical option, such as CABGs, coronary artery bypass graft, where they actually split open the sternum, go in and mechanically take vessels, usually veins from the legs, saphenous veins, and they graft them directly onto this diseased artery to restore blood flow to that damaged heart. Now, what kind of education are we going to provide for our patients who have sustained MIs? Of course, we're going to express the importance of diet and exercise with the overall idea of hopefully reducing any kind of further atherosclerotic plaque deposition to hopefully prevent any recurrent MI from occurring. Smoking cessation is definitely going to be something that you're going to educate your patients on, should it be applicable, as smoking directly is correlated to coronary artery disease and coronary vessel vasoconstriction. Should a patient undergo PCI or CABG, there's going to be specific kinds of educations associated with those that I'm not going to dive into in depth here, but usually they're going to end up being prescribed a variation of medications post-intervention, whether it be antiplatelets or anticoagulants lifelong. It's going to be important that we educate them on the importance of adhering to these and any follow-up appointments that may be applicable. And so to summarize some of our key points related to MIs, remember myo, muscle, cardial, heart muscle infarction or permanent cell death. Most commonly caused by atherosclerotic plaque breaking off or forming completely across that coronary vessel. Remember our little fatty beavers and the dam that they build. A lot of the common symptoms all associated with lack of blood flow to that heart. Remember, our treatments are aimed at reperfusing that heart. We want to reestablish proper blood flow to that damaged heart. So all of our interventions, both pharmacologically as well as procedurally, are geared at restoring that blood flow. Then the patient education, which we just discussed. Guys, I really hope that this video helped bring clarity to the concept of MIs, and I really hope that it helps you as you move forward throughout nursing school. I hope that you guys go out there and be your best selves today, and as always, happy nursing.
If you're watching free nursing videos on YouTube, you're already behind. Nursing.com is a system that gets nursing students out of survival mode and into passing mode. Head over to nursing.com after you watch this video to start your nursing survival package now.